Flora Pro Active. No other food lowers cholesterol more.
The heart is an amazing structure and performs a valuable task. But when something goes wrong, it can result in undesired complications. Today we're going to find out more about heart murmurs and arrhythmias from two top heart experts.
Heart murmurs are actually quite common and often harmless. Cardiologist Dr. Joe Bodenstein explains the phenomenon and how doctors detect them.
Doctor, what exactly is a heart murmur?
A heart murmur is basically a sound that we hear between the heart sounds. When talking about heart sounds, we usually talk about lub-dub, where lub represents the first heart sound, which is the closure of the mitral valve, and dub is the second heart sound, which is the closure of the aortic valve. Anything that occurs between these heart sounds is a heart murmur.
How do murmurs occur?
The origin of a murmur is when there is turbulent flow across a valve. Normally, when there is flow across a valve, if the valve is healthy, you have what we call laminar flow, which is similar to water flowing in a canal. So there's no turbulence and then there's no sound. However, as soon as there is turbulence, then there is a sound generated.
How are these murmurs diagnosed?
When assessing a patient, in the first place we take a thorough history and we listen for symptoms of shortness of breath and palpitations. Then, if we're concerned during the investigation or the examination of the patient, we'll take a stethoscope, which is the basic tool of our trade, and we listen for heart sounds. If we hear something that concerns us, the next investigation will be an ultrasound or an echocardiogram, which is very similar to what we use on pregnant ladies. In this case, however, an ultrasound is done of the heart, which is basically an echocardiogram. It's a duplex Doppler also, where ultrasound is used to assess the heart chambers, the valves, the skin layer around the heart, and we can get very definitive answers as to whether there's a problem with the valves and whether the murmur is a cause for concern.
Are murmurs dangerous and how are they treated?
Not all cardiac murmurs are dangerous. You get a physiological murmur, which is a normal murmur. For example, young children, pregnant ladies, people who are anemic, people who have overactive thyroids, oftentimes have murmurs due to a hyperdynamic circulation. Such a murmur is not dangerous. When the condition is reversed or corrected, then the murmur disappears. If, however, a condition such as rheumatic heart disease has occurred, there's inflammation and damage to the heart valve, the valve either becomes leaky or it becomes fibrosed and tight, then ultimately that will place strain on the heart, and such a valve may need surgical intervention at a later stage and valve replacement.
Dr. Razin Gopal is one of the country's leading experts in treatment of arrhythmias. Using the latest technologies, arrhythmias can be diagnosed and treated much quicker.
Can you please tell me what exactly is an arrhythmia?
In order for the heart to beat, there is a seamless flow of electricity from the filling chambers to the pumping chambers via very specialized nervous tissue, which is called conduction tissue. And when we have a short circuit or a break occurring within this conduction tissue, you have an arrhythmia existing. It's almost like a short circuit, and you've got spark plugs and cabling in the heart, and these then start to malfunction.
What causes an arrhythmia?
Arrhythmias can be congenital, because some people have been born with additional nerve fibers within the heart. They can also exist because the heart has been damaged. We call that structural heart disease. And as a consequence, the heart tends to beat much faster, or alternatively beats irregularly. And this can happen from chambers within the filling chambers of the heart, or alternatively the pumping chambers of the heart.
And how are they diagnosed?
It's diagnosed by a number of means. Commonly, people have symptoms of palpitations, and they present to us and we do an ECG. Or if they are not in the palpitation, we can use various recording devices to document on an ECG what it is that they are feeling at the time of the palpitation. And this is correlated with what we see on paper, and so a diagnosis is made. Another alternative is an electrophysiological study, where we can put catheters inside of the heart and measure numerous signals and sequences of activation to make the diagnosis and to offer a curative therapy simultaneously.
Dr. Gopal can correct an arrhythmia through ablation. This is where heat or freezing cold are used to safely treat the section of the heart where an arrhythmia originates.
Can you talk me through what exactly you're busy with at the moment?
So essentially we have accessed the patient's heart via the groins, and through the femoral veins we have put tiny little flexible wires called catheters, which have on their surfaces electrodes which appreciate the electric signaling within the heart. And we have now put the patient into the palpitation, and I'm able to understand the mechanism and unravel the palpitation, and in so doing I can cure it with ablation therapy. In a way, almost it's a matter of studying the nature of the beast before we slay it.
Well, I guess that old saying of your heart skipping a beat isn't so romantic as we would think, but luckily we've got great doctors and wonderful technology that ensures that our hearts keep beating the right way.
Flora Pro Active. No other food lowers cholesterol more.